A unique type of grab is the bite. Biting can be a common problem, especially in patients who are disinhibited by conditions like dementia or other cognitive disorders. It is important to remind your class that prevention is the key. It is very difficult to be bitten when you stay out of the range of someone's mouth. Many patients at higher risk of biting are also physically debilitated. This may be the reason that they resort to biting because they feel like they have no other way of protecting themselves from what feels like a powerless position. Often we forget that patients unable to strike or grab us may still be able to harm us by biting, and we let our guard down getting too close. Often a bite comes as a complete surprise to staff or other caregivers. Remind your students that bite strength can be very strong even in people who are otherwise physically weak or debilitated. And for this reason, the best protection against being bitten is to stay out of biting range. When bites do happen, you need a safe technique for getting out of them. When we discuss bites in the classroom, we use demonstration only. This is not a technique employees should be practicing in class due to risk of injury. Instead, you can imitate biting your own arm with your hand like this. Ask participants what would happen if they were to pull away from a bite. We know that your risk of injury, including skin, muscle, nerve, and vascular damage, increase when you pull out of a bite. This is why we train participants to feed the bite. Mammals, including humans, have hinged jaws. Pressing slowly toward the hinge of the jaw can cause the hinge to open wider. This causes the mouth to open wider, decreasing the force of the bite. The brief decrease in the bite strength will improve your chances of escaping the bite with less injury. To review, when we teach participants to release from a bite, we use demonstration only. We always want to remind the students to stay on their guard. The key is prevention and staying out of biting range. If you are bitten, never just pull away from a bite, as this can cause injury. The technique we train includes feeding the bite or pressing slowly toward where the jaw hinges, which increases the likelihood that the bite will be released.